Over the weekend, the Health Sciences Authority, HSA, approved the use of the pediatric doses of the Pfizer-BioNTech Comirnaty COVID-19 vaccine for children aged 5 to 11 years. The Expert Committee on COVID-19 Vaccination, EC19V, has also recommended its use for this age group. The process of deriving those recommendations included consultations and engagements with healthcare workers and clinical care providers looking after children. For example, the College of Pediatrics under the Academy of Medicine, GPs, community pediatricians, the teams at NUH and KK Hospital looking after tertiary pediatric issues. And they support this move. The main reason why they are supportive of this assessment, why they agree with the assessment of the EC19V and HSA, is the analysis that the benefits of vaccination far outweigh the risks of getting COVID-19. There's a very small risk of a serious event happening with a vaccination. It's something like 1 in a million. But a serious event associated with COVID-19 vaccination is about 2 orders of magnitude more likely, about 100 times more likely. It's closer to about 1 in 10,000. And we have seen this happening even here in Singapore, and certainly from the data that we have been studying around the world. Vaccination is safer than getting a COVID-19 infection. COVID-19 does tend to be milder in children compared with adults, and severe disease is uncommon. But there is still a risk of children developing severe disease, with some cases requiring hospitalization, oxygen supplementation, and ICU admission. We're seeing about 1 or 2 cases of multi-system inflammatory syndrome in children, MISC, about 1 to 2 cases every week since mid-October 2021, and some of these children have required ICU care. Getting our children aged 5 years and older to receive the COVID-19 vaccination will help protect our children from getting the COVID-19 infection and keep them from getting seriously sick even if they do get COVID-19. So, reducing the risk of severe complications such as MISC. The study in the US of the Pfizer-BioNTech vaccine was in children between the ages of 5 and 11 years old. And this study demonstrated a vaccine efficacy against symptomatic infection of about 90.7%. Our children, as you know, will spend a lot of their time in places like schools and preschools. And here, transmission can spread quickly, not just of COVID-19, of any disease as the children interact. And this then puts at risk the family members of such children, whether they are siblings who are younger and so not yet eligible for vaccination, or those who are older, such as the grandparents, who even if they are vaccinated, the risks are higher. And so, by reducing the transmission in this age group, 5 to 11, we protect them from the risks of severe complications of COVID-19, but we also protect the rest of their family. Putting all this in place through vaccinations for this age group will reduce the risk of transmission in children of school-going age, and it means that there's less likely to be a disruption to their education and their opportunity and ability to carry out co-curricular activities, which is what we want for them. The dose of the Pfizer-BioNTech Comirnaty vaccine for children aged 5 to 11 is 10 micrograms. It's 1/3 the dose for individuals that are older. And for COVID-19 vaccination, children may also experience some side effects: muscle pain, redness, swelling, tiredness, headache, fever, chills. These are all signs that the body is reacting to the vaccine and, as a result, building up protection and immunity. And these side effects will go away in a few days. And many people, there's no side effects, and severe reactions such as allergies are quite rare. The trials of the vaccine in the US compared the side effects of children aged 5 to 11 with side effects for young persons aged 16 to 25. And they found that the younger children, 5 to 11, had fewer systemic side effects. We have been giving vaccines locally here across our population, a large number, as I explained at the beginning. And in our population, the older population, we also continue to observe that the risk of side effects like anaphylaxis is low. and it's comparable to many other medications and vaccines. There were no cases of anaphylaxis seen in the US vaccine trial. There were also no cases of myocarditis and pericarditis. Excuse me. There were also no cases of myocarditis and pericarditis in the trial aged 5 to 11 in the Pfizer vaccine in the US. By now, millions of children around the world have been vaccinated using this Pfizer BioNTech Comirnaty vaccine. Up to 5.5 million children in the US in this age group have received the first dose, and 2.6 million have completed 2 doses as of the 12th of December, with no safety concerns. So it's important that we offer protection to our school children before school activities resume full swing. Vaccination for this group will commence before the end of this year and once we receive deliveries of the vaccine doses. To help us strengthen COVID-19 resilience for Singapore, we need to have our children between the ages of 5 to 11 years old get their vaccination as soon as it's rolled out. We know that parents are concerned. They want the best thing for their children. They want to be able to protect their children and create opportunities for their children. This is what we want as well. And our assessment is the best way to do that is to vaccinate our children against COVID-19.